A 28 years old man undergo an ileocecal resection and end ileostomy. For what reason? For the Crohn's disease. 1 year later, he present with deep painful ulcer at the stoma site. What may be the diagnosis? Here the options. Options are bullous pemphigoid, pemphigus vulgaris, pyoderma gangrenosum, squamous cell carcinoma, and poorly fitting appliance. So we have to find out the cause or the diagnosis. That means a Crohn's disease patient who undergone ileocecal resection and there is a permanent or end ileostomy. There is an end ileostomy for this Crohn's disease. But 1 year post-operatively, he developed deep painful ulcer around his stoma site. What is the diagnosis? So first of all, here we can see this is a stoma. This is the stoma for the Crohn's disease, and here we can see the round part or ulcerated part. Here the ulcerated part which is covered by the ointment, and here the ulcerated and reddish area surrounding this ileostomy. So what is the diagnosis? That the second picture also, here we can see this area here, this is the ulcer surrounding the ileostomy. There is a definitive ulcer present. So what is the name of this? First of all, here we can see the pyogenic pyoderma gangrenosum. This point very important, which is the pyoderma gangrenosum. It usually associated with IBD, that means the inflammatory bowel disease. So in case of inflammatory bowel disease, pyoderma gangrenosum develops. It is a direct, we should remember, there is no tricks. We have to remember just one word, that when there is inflammatory bowel disease, there is chance of development of the pyoderma gangrenosum. And this treatment usually involve the steroid. When we will give the steroid, then this type of the inflammation will be resolved, because the inflammatory bowel disease, it is an autoimmune disease. Not only for inflammatory bowel disease, for any type of the autoimmune disease usually responds with the steroid. So any type of the autoimmune disease we should give, or we should go for steroid. And it would be rare for poorly infiltrating appliance due to cause of deep painful ulcer. In case of poorly fitting appliance, there are usually no pain, because in poorly appliance there is no pressure, there will be chance of leaking, there will be chance of make more space, so there is no pain. As there is painful condition, so it is very likely to develop the pyoderma gangrenosum. So what is our answer? Direct. Keep in mind that in case of Crohn's disease, there is pyoderma gangrenosum develop. And there is another important point, which is the deep painful ulcer. That means pain, there is ulcer. Pain, ulcer, and Crohn's disease, it is pyoderma gangrenosum.